Well, I was really honored for being invited, and I would say that that's the best opportunity that one can have to contribute to the most important annual health conference. So that says all. Well, I would say that I very much liked one research project that we had in Europe quite a number of years ago, because it was still this competitiveness and innovation program project. And that demonstrated that digital tools support patient-clinician relationship quite remarkably, but in case they are already well established. So I would say that all kinds of connections that we can have between the healthcare providers and patients or relatives or any clients in general, that is one of the options that we can use. It is not the only one. It is not replacing the simple face-to-face contacts with the doctor and the patient, but it is something that we can have in addition, or in case there is nothing else that works. For example, I think that COVID-19 has very well demonstrated the need for this type of services where we can have the remote consultation, we can have the connection using the video conferencing tools, we can use the e-consultation for primary care and specialist services. So it has offered already before a lot of opportunities for people living in remote areas. But now with COVID, looks like everybody was living in a bit of remote area, and digital tools have really, really helped to fill the gap. The cross-border healthcare, as it is now in European Union, has really benefited from these digital tools for people with rare diseases or people with complex diseases or people working in another country and who would like to have the medical help in their mother tongue or in their home country. So that is something that digital tools have really supported or has brought them into the new level. I think that European Reference Network, for example, is the excellent example of it, or that people can really consult with the doctor on a distance in case they have a serious question or even a simple question with their chronic condition or an acute disease. I think that we have to pay serious attention to cybersecurity and data protection, because that is something that creates trust if it is well established, the systems are well controlled, and I, as the data owner, whether it's a hospital or it's the patient, be confident that nothing happens with my data that I don't want to. They will be seen by people who have to see it. And they will not be also changed, because sometimes with health data, it is very important that my health data will remain intact and will not be modified, which would sometimes may seriously harm my treatment progress. So these items, cybersecurity and data protection, if they are well in place, I think that people have trust for the digital services and will use them more effectively. So that is something that we absolutely have to pay attention for. And then we also have to think about engaging the end users from the beginning, so that the tools that we create and that are in use are simple, and they can be easily used by the patients at different age groups, because not everybody is so digitally literate as, let's say, 20, 30 years old young people. And not even among them, we can also find people who are not so digitally literate. And we have to work also on digital health literacy, because nowadays it becomes more and more important to make sure that information that reaches people is correct, it is evidence-based, and that is serving their health. It is not confusing, or it is not fake news, or it is somehow doing harm for the treatment progress or for diagnosis, or sometimes just misleads healthy people to the wrong way. I think these aspects really need to be well addressed. And digital literacy is also, and digital health literacy is also important for healthcare professionals. Sometimes we believe that health literacy is something that automatically comes with the diploma of a doctor or nurse, but in principle, to put at the same level both patients, citizens, and healthcare professionals, we have to know at what page we are. And we have to know the same things at the same level, and we have to find this information from the similar source. Of course, healthcare professionals need more specific information, and they can deep further by looking at the data and looking into the studies. But it's important that patients also are informed about what is happening, what is going on, and that is really an evidence-based information that reaches them. If we manage these aspects, education, training, engagement, data protection, cybersecurity, I think it should work. I think it will be very interesting. It is time to start not only talking what we should do, but I am very much hoping that this Congress is also going to share what has been done, what has been achieved, what are the lessons learned, what we can take from here and use it for the developing further the digital health tools and policies. I think it's the good opportunity to look at the different parallel sessions at the different angles. You can physically be in different places at the same time. It's an opportunity for networking. It's an opportunity to take notes. It's an opportunity to ask questions and get professional answers. And most of all, what I like it most is that you can stay at home.